Hi there, and thank you for joining us for this special edition of State of Texas. I'm Wes Rappaport in for Josh Hinkle. Hours after he announced a public health emergency in Texas, Governor Greg Abbott came here to our studio along with key leaders in the state's response to the coronavirus. For an hour, he answered your questions in a virtual town hall broadcast live across Texas, hosted by our Robert Hadlock. The governor started with a message to Texans.
I know that many of you are concerned, maybe scared, maybe confused. You deserve answers, and we appreciate Nexstar for providing this opportunity where we can begin to answer your questions. Second thing I want you to know is we're dealing with a very real challenge, a challenge that we collectively must respond to. Understand this, part of the confusion about this whole thing is we're dealing with an invisible danger. You know, often you can see a hurricane come in, or you can see a fire taking place, or you see a tornado, whatever the danger may be, you can often sense it with one of your senses. A communicable disease you can't really sense. And so it's important for you to be able to make sure that you listen to what we have to convey tonight so that you are going to be prepared to respond to this challenge. I want to make sure that you know that we are prepared to help you respond to this challenge. The first instance of COVID-19, which is the official name of the coronavirus disease, the first time a Texan contracted it was on March the 4th. This time next week, there will be thousands of people who will have tested positive. In 2 weeks, probably tens of thousands. This is a very rapidly spreading disease, but it's one that we are prepared to respond to. We've been prepared beginning in January with these officials working with federal and local officials to make sure we are ready for this, and we were ready in January before it first hit Texas in March. What we're doing now is we're focusing on testing. We've already conducted thousands of tests, but we're prepared to do 15,000 to 20,000 per week. And in a conference with the president today, he let us know that pretty soon we will be able to do well over 10 million in a month. And so the tests are ramping up quickly, but the main thing we're focused on right now is really the only thing we can do to secure your safety and public health in the state of Texas, and that is to contain expansion and transmission of the disease. Working together, we'll get it done. Two quick stories, then we'll get to the questions. One, the first time that Texas dealt with the coronavirus was when the United States military flew people who were evacuated from a cruise ship into Lackland Air Force Base. There were 91 people. One was hospitalized because of the exposure to coronavirus. All 91 of them are now home with their families, safe and sound. It's a great result. We want to see replicated all the time. Last point. We all remember what the state of Texas went through just a couple of years ago when we responded to Hurricane Harvey. You can remember what used to be roadways turned into riverways that nobody could escape. An entire region around Harris County was inundated. And yet, even though people were homebound for weeks, what we saw was the heroism of our fellow Texans stepping up and helping each other, taking rowboats or canoe boats or kayaks, whatever the case may be, helping out their fellow Texans, and together we made it through. Together we will make it through the coronavirus also.
Governor, thank you for that. Before we really get started with the questions, I'd like to ask you, have you been tested for the coronavirus?
I have, and very importantly, I wanted to make sure that knowing that since the coronavirus in Texas has been around the state for a month, and since that time, I have shaken hands with or hugged or encountered thousands of Texans. I owed it to my staff, to the people of Texas, as I lead this effort to make sure that I was tested, and I tested negative, which means I don't have it.
And what about your team here?
I don't know.
I haven't had any symptoms.
No signs and symptoms. We're checking our fever every day.
Okay, good. Well, let's update our audience now. The governor announced an executive order. You emphasized it's not a shelter-in-place order. All critical infrastructure will stay open in Texas. Domestic travel stays open, and your executive order includes 4 steps statewide. First, avoiding social gatherings of more than 10 people. No eating at dine-in restaurants, bars, or food courts, and all gyms are closed. No visiting nursing homes, retirement centers, and long-term care facilities except to provide essential care. Finally, you ordered all schools to be temporarily closed, though you encourage online options to continue children's education. Let's break down each of those statewide actions and their impact so far. First, to clarify, you said all schools, that is private schools included, and all colleges and universities. Lots of questions tonight on Twitter about this. What can you clarify?
Yes to all of that. So
Okay.
this applies to any type of educational institution. For higher education institutions, the anticipation is there will be certain aspects of the higher education location that may be open. For example, food courts at a higher education institution may be available, or students who are relying upon dining operations at the university will be able to access that. There could be other services, there could be certain exceptions. Let me give you one example, and that is you have a laboratory at a university where they're undertaking some experiment. There could be a special exception granted in a unique situation like that. Here's the way this works. My office is working in collaboration with the presidents and chancellors of all the university systems in the state of Texas to work out what will and what may not be open. You need to be in communication with the person that you work with at your university or college so you can find out what you can and cannot do.
Mike Morath from the Texas Education Agency, is there any hope that we could open our public schools before the end of May?
So the order for closure lasts through April 3rd, and we're waiting and looking at the data as it comes in. We want to make sure that first and foremost we're making public health decisions based on the best science. How do we keep our students, our staff, and our communities safe? So I think we need to wait and see how the spread of the virus unfolds and what the data tells us as we get closer and closer to April 3rd before we determine whether a longer closure might be necessary.
Could you see it going into June and July, maybe in August, to complete the spring semester?
Well, for most of our K through 12 schools, they're going to be finished by early June regardless, as the normal school schedule. So again, depending upon how we see the spread of the virus, we will adjust accordingly.
Governor, you waived the STAR testing requirements this week. Will students advance to the next grade without the state assessment tests?
Yes.
Yeah, the short answer is absolutely yes. So what we've done, with, subject to the governor's leadership on this issue, is ensure that our local school systems are empowered to make the best decision for our students. We want to ensure that our students are learning and they're progressing academically, and we want to make sure that we maintain high expectations for them. But the STAR has essentially been removed from consideration. So this is the judgment of local teachers and principals as to what's the best support for each student.
If I could just add, I mean, these are unique times that call for unique solutions, and we're going to be flexible in delivering solutions that work in our society.
Now, one concern a lot of Texans have is whether they will be able to get those everyday supplies that they need.